example, a woman that doesn't go through proper preconception care could probably be pregnant and not know and take maybe paracetamol antibiotics.
Or
malaria drugs. So those drugs can be teratogenic, like they can affect the development of the unborn child. And when the child comes out, it comes out disabled.
A patient is rushed into the hospital and the doctor has to put himself or herself together, to save that life, regardless of family issues, personal issues. How do doctors manage this headspace?
Well, it varies actually. To be honest, you'll be amazed that some people are in that space and they really don't care. They just want money, a good money that can make them travel out of the country.
The Industry Miner, birthing and nurturing industry giants.
Hey there watching, my name is Aisha Ochoa, a lawyer, business consultant, and executive. I welcome you to yet another episode of the Industry Miner podcast where we connect you with some of Africa's brilliant minds. Now, these are people who have shown themselves approved in their niche markets by, setting up businesses, running businesses, and ensuring success. Before we jump into today's episode, I want you to join our fast-growing community by clicking on the subscribe button and following all of our social media platforms so you do not miss out on brilliant interviews with all of these industry generals. Now, today's session will be divided into two parts. And on the first part, we have on board someone who is a certified healthcare management consultant with over 10 years of excellence in practice. I am sure he has a lot of liquid gold, verbal gold to share with us today. So stay tuned while I welcome the amazing Mr. Nifemi Adeyemo. Welcome on board today, sir. How are you doing?
I'm doing fine today. How are you doing?
Very well, thank you. Thank you for joining us today. Now, let's dive right into today's business. Can you tell us about your professional background and what's inspired you to, pursue a career in healthcare?
All right, thank you so much. Again, not that I decided to go into the medical space.
Okay.
To be honest, growing up as a young child, I wanted to make money. Initially, I was scared of poverty. Some people were born with silver spoon, golden spoon, while some people are born without spoon. No spoons at all. So I grew up in a community in an area where we just wanted to be relevant and wanted to be good, wanted to make money. But along the line, I think around my early secondary school days, I just started getting this flair for the healthcare space. Whenever I go to the hospital, I like how things are being done. Then passion actually grew from there. Eventually, I found myself in a medical school, Obafemi Awolowo University. All right. And, through school, in fact, in my last few years in school, there is this award they do in classes. And I got only one award, which is the award of most unlikely to practice.
That was a thing?
Yeah, because all through school, I did businesses from owning a printing press to owning a massive eatery on campus that almost everybody knew about, to like a lot of businesses. And I was so much into the music space too. So it's even difficult for you to know that I'm in the health sciences. In fact, most people thought I was in the art or maybe the commercials in the university, So my classmates just felt like, you see, this guy, we're not sure he's going to practice anything around healthcare. Just leave this guy and let him go. But unfortunately for me, or let me say fortunately, around the time that I finished my NYSC, my mom was diagnosed of diabetes long before that time. And at that time, I could remember she had a wound on her leg, one of the foot, and it became bad. And we eventually, to cut the long story short, I lost my mom to diabetic foot, which could have been treated if she had access to good quality healthcare. So the passion...
I like where this is going.
Yeah, the passion just surged at that point. And I told myself, you know what? I could remember bearing and I was promising her that I'm going to do my best to ensure that every Nigerian that I come across get a better healthcare, because I know how it felt to have lost your loved one, your mom, at that point where you needed her the most. I was just coming out of NYSC. You want to think about marriage, think about things that you need your mom around for. And, we lost her. If she had access to quality healthcare, there are a lot of people that have diabetic foot and they are living the fullness of their life. So she didn't have access to quality healthcare. We lost that for that reason. So the passion for healthcare just surged, and since then, they say the rest is history.
Amazing. So what aspect of healthcare do you specialize in, and why did you choose that field?
Okay, before the demise of my mom, while in training, I got interested in mother and child. That's the care for mother and child, because one thing about me is that I like impact, and I was exposed to the knowledge of the fact that there are researches that support what I want to say right now. Quite a number of people that are disabled right now, or that have some impairments or impediments in their life, stopping them from achieving their full goal, right? Got some of these issues either before pregnancy, during pregnancy, or during their birth. For example, a woman that doesn't go through proper preconception care could probably be pregnant and not know, and take maybe paracetamol, antibiotics.
Or
malaria drugs. So those drugs can be teratogenic. Like, they can affect the development of the unborn child. And when the child comes out, it comes out disabled. And even during pregnancy, there are things to avoid and all of that could help the delivery process and also help to achieve a good baby, good mother. Then the most important one is that birth process. Imagine a child coming out and maybe the decision to birth the child is not properly made, and this child comes out with birth asphyxia, that is not crying immediately after birth or swallowing meconium. That could determine the level to which the child is going to get to in life. Some children that cannot cope with academic stress and all of those things, some of them didn't have the opportunity, even from the time they were born. I mean, they had issues around their birth. So when I thought about all of this, I just felt, you know what, I'm going to put all my energy and strength in the mother and child space, such that we reduce maternal mortality and we also increase the survival of children coming into the world. Thank you.
Wow, amazing. Now, I understand that you're the founder of Recon Health Solutions.
Yes.
So how did this come about, and how do you handle issues of team building? How do you ensure an excellent service delivery?
The moment I gained my certification as an healthcare management consultant, at that time, I'd worked with the big wigs in the healthcare space, some what you can call 5-star hospitals. But at that time, I was working with an oil and gas company.
Oil and gas.
And I was making all the money. But I remembered when it just came back to me that I was already getting comfortable. All right. And it was far away from the quality healthcare that I want to, deliver to the country, to Nigerians. And I got to a point, especially in the oil and gas, where I saw perfect healthcare. Permit me to use the word perfect, because I've not seen healthcare that is as detailed as what I experienced or practiced in the oil and gas space. And the reason is just because they have the money to fund it. So for the very first time, I saw complete rounded holistic healthcare. So when I saw that, and it came back to me that I should step out to go and start my own, I'd spoken with quite a number of people. I'd helped them, come up with their hospital, establish their hospital for them and all of that. But sometimes when I relate with them, they say stuff like, you don't know how it feels like. And it makes me feel like, maybe because I've not handled one myself, it's a thing to help people establish their hospital and run it for them. It's another thing for you to be in their shoes. So I said, okay, so that I can have a rounded experience, let me give it a shot. So I stepped out that, okay, all of this knowledge and theory that I know in my head, can I put them to practicals, and let's even see if it is workable in Nigeria, which we did. And I can tell you for free that it is very workable. As a matter of fact, there's no such thing as Nigeria is a dead end when it comes to quality healthcare, because by God's grace, it will cost you more. Maybe when we go deeper into this conversation, I would let you see how it could cost you more, but it's still achievable.
Amazing. So now, relying on your statement, right, about starting a business or starting, running a system in the healthcare, I'm sure a lot of our audience will like to venture, right? So how does someone who has little or no experience in the healthcare sector start and run a business, a successful business? Or how do they even draft a valid business plan?
Well, I'm not going to dwell so much on this because a lot of good materials are out there as touching drafting a good business plan. One of the materials I would recommend is the Industry Miner by Aisha Oshawa. You did a great job. I went through the book and well loaded. I mean, anybody going into establishing any kind of business, especially in the healthcare space, should get that book and read it. Just read the book and digest it. Even though there are peculiarities to the healthcare space, all right. But if one wants to start an healthcare business, the first thing, the sincere question to ask yourself is, do I want to multiply money? Like, what is your goal? And let me state it clearly that please, if passion is the reason why I want to start it, and passion is the only reason why I want to start it, if you don't have the money to fund it, don't start it. Because passion doesn't fuel anything, in the sense that you will need money to go into the healthcare space. And why I said you should ask yourself that sincere question is, if multiplication of money is your major reason for going into the healthcare industry, you will mess it up, because at the end of the day, you will discover that it takes time to actually make the big money you want to make. Passion must be mixed in a good balance with you desiring to multiply money, because whether we like it or not, the healthcare industry is more of humanitarian than a business.
Now, talking about money, let's talk about financial management. So what advice can you give to, small business owners who struggle with the issue of financial management? Because I know for a fact that it's a big issue in running businesses, especially in Nigeria. How do you manage that aspect?
It's still the same approach to every other business. The first thing is you want to ensure that from the word go, you ensure that all your bookkeeping is accurate. Ensure that you have a separate account, which is not your personal account, for your daily income and expenditure. Then try as much as you can, because I made this mistake. Not like I didn't know what to do, but I just gave excuses for it. And now I have to go back to the drawing board to fix it. In as much as you know that you will not start that business without a doctor, don't start without an accountant. Because your business management account, all right, will be required of you as you run the business. And as a matter of fact, you're going to get to a point where you need injection of external funds. And nobody's going to give you external funds without a clear business management statement account of how your business has been running. So I would advise you that just the same way, it's very important for you not to start that hospital without a doctor. Don't start without an accountant.
Amazing, amazing. Now, we all know that the world has become so digitalized with technological advancements springing out every day. Now, which of these technological advancements are you particularly excited about? And how has it, impacted the way healthcare is practiced and, even medicine, the application of medicine in today's world?
Well, maybe I shouldn't go towards the extreme end of excitement.
Okay.
Because technology in itself is just blank. What do I mean? Because the invent of technology is to make processes easier and faster. Now, there is a big gap in the healthcare space, and I'll tell you why. Because of the peculiarity of the profession, until you have a good understanding of the profession and the problems in the profession, that is when you can bring in technology to come and solve those problems. I've seen electronic record keeping in the medical record keeping in the healthcare space, and I can tell you that hospitals that have been able to maximize that technology to the fullness, they are not much. Coming from the fact that the doctor that you've employed came from the paperwork, like writing. Now you're putting a system in front of the doctor. So the educational system that trained these doctors didn't give them the opportunity of the digital world, typing and doing all of the things on the system. I struggled with it at a point when I was with one of the hospitals I mentioned. It wasn't something we were used to. It was as though the brain is already attached to the pen, such that you hold your pen and you can write. But the moment you start typing, it slows down one or two things. It's not like people have not been able to overcome that problem. Some people are achieving a good electronic medical record right now, but it's very expensive and it's not something I'm excited about yet, though good, and is really improving the healthcare system. Like if you come to a particular branch of a hospital, let's say on the island, and you're traveling to Onitsha, they don't need to call for your medical record. They only need to log in into the cloud, download your medical record. So it makes the communication of healthcare
Easier.
faster, and it makes the continuous care also faster. Patients record in time past, if any hospital should get burnt or fire outbreak and all of that, you can lose all of the patient medical record. But right now, it's in the cloud. There's another part of it that is a bit interesting, is nursing informatics. So the nursing informatics system is actually a system of care, of continuous care. All right. And it's been digitalized. It has assisted the nurses because sometimes they get busy with documentation. And in healthcare, whatever is not documented was never done. And the documentation in healthcare is one of the legal properties in healthcare. We're still going to get to the legal part. That must not be missing. If anything happens, we'll go back to the documentation. So if, for example, a nurse said or wrote claims to have done a particular procedure, or that procedure was not documented, is as good as you didn't do it, man, because there's no proof.
No reference point.
So, and that documentation eats into the time of the nurses. So they have to keep documenting. Imagine you want to document everything you've done to a patient. So it reduces their efficiency. A technology came in to say, you know what, you can say these things, and instead of typing it, it's being recorded. And the electronic medical records also gives room for that. You just click on a click. There's already templates of what you did, like bed baths. The details of bed baths will just appear. You only need to edit one or two things. Drug administration, just click it. All the details that you ought to write, plus the time, plus the date, everything will appear. You only need to edit it and modify it. Another part of technology that we have right now is diagnostics. Technology has really helped diagnostics. It is not the way it used to be. Before now, we usually have large machines for diagnosis and all. You can imagine you as a sonographer or radiologist going into the patient's room with just your phone and a probe to do ultrasound scan. Instead of telling the patient to go downstairs or go to another diagnostic center. So technology has actually helped the healthcare space. But in Nigeria right now, because of the cost of this technology, importing this technology and being able to maximize this technology, we've not gotten there yet. And that takes me to the landscaping of the healthcare system in Nigeria at the moment. Lack of funds. The healthcare system is underfunded right now. And lack of funds is really affecting the healthcare system. Even though globally, even in Nigeria, the healthcare system right now, the worth of the industry is over $18 billion. But maybe because of some of the regulations and policies that are still in place, is not helping people to come into the space to fund it. The one I can quickly talk about is the fact that almost every Nigerian believe that if you are not a medical doctor, you cannot own a hospital. And the way the policy is also that the hospital will be attached and we won't drown the medical doctor. In fact, when you as the hospital owner, if you invest in a doctor, you will not be allowed to attend the medical meetings of hospital owners. They will tell you it's your doctor that must come. Nobody's going to take that from you. I'm investing 500 million into an hospital. Then I employ you as the medical operational officer. And when they have a meeting that has to do with the hospital, with the Association of Hospital Owners, is the doctor that must represent me in that meeting. Then I don't want to invest in your space. The moment we have policies that opens up the business to non-medical doctors to be able to invest and also have at least the say when it comes to gathering people together. They call it hospital owners, private practitioners and hospital owners, but you will never see non-doctors there. They want everybody in that meeting to be doctors. And this is one of the major challenges. Like you, for example, if you feel after this good conversation, I want to invest into the healthcare space. The limitation is the fact that you have to get, of course, which is normal, an operational officer, which is the medical officer that will be the one upholding the license, the accreditation of the hospital. But when it comes to meeting and making decisions, because of the stringent policy right now, you won't be able to attend those meetings.
Wow. That's something. That's deep. I'm sure you've given us a food for thought, and a lot of people are thinking about this right now. Now let's talk about quality assurance. I know quality assurance is a must in the healthcare sector.
Yeah.
So as a certified healthcare management consultant, how do you think doctors who practice can, how do they manage getting the true worth of the services rendered while also considering the state of the economy or the financial capacity of their patients?
Yeah. So again, 80% of the success of any hospital lies on the administrative arm. So the healthcare, as it were, can be divided into two, the clinicals and the administrative. Now, hospitals that have imbibed this structure or that are running on this structure, they do better. If you check back a bit, in another 10 years behind, or let's say in the past 15 years, you discover that when you go into any hospital, the doctor that is attending to you is the pharmacist, the doctor is the HR, the doctor is the accountant. You pay in his office. And hospitals were small because there was no structure. But when we had the likes of, I don't want to mention him, but some hospitals came up, they learned these things and they started putting structure to it. For example, my own hospital, the success of the hospital is from the 80% contribution of the administrative and 20% contribution of the clinicals. So when you talk about quality assurance, the best way to assure quality is to divide it this way and ensure that it runs that way. Let me give an example. If you come to my eatery and you ate a meal and the meal is delicious, that it's delicious doesn't make me a success because it should be delicious. If you come to my hospital and you got well after 3 days of admission, let's say you came in to treat malaria, I shouldn't jump around as a successful hospital owner. Because if you come to the hospital, what is expected of you is that you should go back home well. So it's the other things added to you getting well that makes the quality better and assured. So it's other structures that I've put to place, like your admission process, the way the room is, the nurses' services, the doctor's services, and you see, hospitals that I just mentioned, the big wigs, they have a department called quality assurance. So these people go around with case managers to ensure that what the patient is paying is commensurate to the quality of care that is being given to the patient. They come, sometimes when the quality assurance come to our words, then they will even call you to come and do hand washing. How do you wash your hand? I mean, to the details, to the letter. They want to be sure that you admitted this patient 3 days ago. Why is this patient still on the bed? This patient is paying the hospital. I mean, those are hospitals that have gotten the structure. This patient is paying heavily. So why is this patient going to pay another 50,000 naira for bed space if you've done your work well? And sometimes they go through the case notes to be sure that the doctor is doing what they ought to do. So it's just about understanding the fact that this is life and insisting on quality care. So you can never achieve quality assured care without a proper structure. It starts with structuring, realizing that the healthcare space is divided into two, the clinicals and the administrative. And the success of the hospital is 80% on the administrative. Thank you.
Now, talking about life, right? I've always been curious. How do doctors handle the emotional aspect of their practice? Because I know it's not uncommon for crisis to occur, life and death situations where a patient is rushed into the hospital and the doctor has to put himself or herself together, to save that life, regardless of family issues, personal issues. How do doctors manage this headspace?
Well, it varies, actually. To be honest, you'll be amazed that some people are in that space and they really don't care. They just want money, a good money that can make them travel out of the country. And that is now even on the increase right now. They just want to get out of the country. Okay. So they really don't care about whether the patient is fine or not fine. But I can tell that the first thing to ensure is that if you have a good conscience and you have a good understanding of life. So for me, what works for me is that I see every of my patients as my family member or even myself. And I tell them, there's a slogan in my hospital, it can be anybody. So once you keep thinking of the fact that it can be anybody, it means that you don't want your emergency room to be disordered. You could be the next person that need that emergency room to stay alive. And the value of life, sometimes, so when I go around hospitals to talk to their staff, I emphasize on the value of life. The value of life in the country, Nigeria, needs to be emphasized on. And that's why you see the whites, the way they value life is not the way we value life.
Of course.
So the value of life is what makes a doctor conscious of the fact that this is life. We call it patient, but it's somebody's mother.
Somebody's husband.
Somebody's breadwinner.
Yeah.
Somebody's lifeline.
Yeah.
So the moment you put all of those things into consideration, you want to treat that person much more than what you call patient. So we call them patient, but much more than patient.
They are way beyond that.
They are way beyond. It's a life. So that's the way I see it.
Amazing. Now that's very deep. So talking about traveling out, let us analyze the Japa syndrome that has broken out in the healthcare sector. Now, what do you think, can you comment on the fact that our professionals, I'm talking about professionals because they are the ones traveling.
This is a very deep topic.
Our professionals
are you sure you
traveling.
Want to delve into it?
No, I've always wondered, can you comment on the fact that our professionals travel and go to lend other countries their expertise? What effect do you think this will have on the Nigerian healthcare sector in the nearest future?
Effect. Before I come to effect, left to me, if I take out my personal convictions and the love for Nigeria, I should not be here.
Wow.
Because to be honest, the healthcare space right now is frustrating for all of the professionals practicing in there. And the problem, because the truth is, if we have a room flooded with water and we want to scoop out the water without necessarily getting to where the water is coming from, the source, maybe a broken pipe, we'll keep scooping. And the more we scoop, the more the water will keep flooding the room. And guess what? We'll eventually not get to the source of that water. So when we talk about Japa, we have to start from the source of the problem. An average Nigerian feels that healthcare should be cheap or even free. Just like education. I have some few solutions that I'm going to talk about here right now. I started analyzing the problem of the healthcare space. And I discovered that healthcare was, the allopathic healthcare, the healthcare medicine itself. I'm not talking of the traditional medicine that we had before the white guys brought healthcare to Nigeria. So the first thing to ask ourselves is, how did healthcare, what we call healthcare right now, how did it come into the country?
How did we transition from traditional
to the allopathic? How did it come in? They brought it into the country and it was free. It was literally free. Free at our end, but being paid for heavily at the other end. So somebody paid for it. Somebody dropped their life earning for that healthcare to be free. So, but because it came free, the way we saw it was that it was free. And we want it to continue to be free. So somewhere in our passive subconsciousness, we feel like healthcare should be free. That is the beginning of the problem. The value they are placing on doctors, nurses, and medical practitioners has also dwindled. Hence, everybody wants to migrate towards anywhere they are well valued. And I think that's where the problem is. You will not want to render a value to people that will not appreciate it. Because it's the same thing, the same value you're rendering here. You can imagine delivering a child in, let's say, Lekki. Right now, it should be around 750,000. The procedure alone, vaginal delivery. Then the same delivery of babies in, let's say, Awoyaya, still on the island, is about 200 to 250K or 300K.
Imagine.
As a doctor, you won't want to stay in Awoyaya. Because when we talk about migration, it's not just the one that is eating the whole country right now is traveling abroad. The rural communities are suffering because all our doctors have migrated away from the rural community. And when the desired is not available, the available becomes the desired.
That's true.
Then quackery will increase. That's the effect. Quackery will increase. Then there are a lot of people flying themselves around now, impersonating. Because when the desired is not available, anybody that is available that says I can do it, then you open up to the person. And it's not just our doctors that are migrating. Even tourism, medical tourism, they are also migrating with them. So where I'm going to is that the effect of the Japa syndrome is not something all of us want to live to see. Because right now, I can count the number of pediatricians on this island. Yeah.
They've all gone.
I can count the number of neurosurgeons. There are a lot of specialties
and they're being appreciated over there.
They're being appreciated over there.
Heavily paid.
The hazard allowance is okay. Here in Nigeria, hazard allowance is almost zero. In fact, sometimes you have to beg for it. You have to go on a strike and, industrial action just for you to get your hazard allowance. And these doctors, these nurses, these healthcare professionals, they're exposed to hazard. How do you explain it? I was to take a delivery one day and the lady already had HIV, heavily loaded. Her viral count was very high. So everybody started moving away from her and she was already in labor. I had to just conclude in my mind that, see, I'm going to wear my PPEs and ensure that I safeguard myself. But I had to deliver that woman. That's hazardous. We face that almost every day. That kind of woman now, if she needs surgery, she has to do surgery. Don't forget, when, not COVID now, the first incident of Ebola, doctors went for it. Doctors, nurses, chickenpox will come, doctors, nurses. So we have all of those incidences. So the question is, what was done to their family? If it happens abroad, all right, they will do something. I mean, they will compensate the family.
Members will be well taken care of.
All of a sudden, the woman that spearheaded the Ebola thing, I mean, she took everything in and even lost her life to it. Where is she today? Who remembers her? So these are the challenges that we have in the country. It's much more than what it looks like on the surface. Now, some of the few solutions that I've been able to at least think around, of course, we have to still test it to be sure that it's workable, is stock option. If a doctor knows that if I practice and I serve this particular maybe private sector or government, they are sure that they have a percentage of what is coming in. Imagine somebody dedicating 20 years of his life to a private hospital, and after he's done, the owner just says, thank you so much, you've been a very good staff, But imagine if after working for 5 years, you know that even if it is 0.1% of what comes into that hospital, aside your salary, is your own, you become part owner. They give you equity as stock option. People might change their mind to say, you know what, I want to work for the future. Imagine there is a bond signage system so that when people leave school, all right, the federal government is able to say, you know what, we have a staff quarters for you, we have a car for you, and we're going to sort this, sort that. They have good insurance scheme, health insurance scheme that is working. And all you need to do is just sign that you work for us for maybe 5 years, maybe 10 years. Then in that process of working, you make sure you intentionally look into their welfare and ensure that part time you are adding motivations. Because when they are motivated, after that 5 years, they now say, you know what, you were living in 1-room quarters before, or 2-room quarters. We have built this 4-bedroom duplex for senior doctors that have practiced for about 10 years. Do you want to come into it? Then sign another bond with us that, you'll be with us for another 5 years. Before you know it, some people might consider some of these things. Doctors were posted to Kano. They killed some of them. Doctors were posted to rural areas. A lot of things happened to them. Their children. Who takes care of their children? Who would want his or her own child to grow up in a rural area, not having access to the kind of wealth that he has? He's earning a lot of money, but his children cannot have good access to quality education. He wants to travel out. So we have to look into this like one after the other, precept upon precept, then we can at least provide a solution. But for me, I'll still drop it here to say that, you know what? Some of us have to start planting trees that we will not live under. Trees that we're not going to get shade from. So that is what I'm doing right now. I'm also sacrificing. You know, if everybody would say, you know what, I'm going to sacrifice, because if nobody's going to do it, it will be undone. And God forbid that people now get to the hospital and there's no doctor to attend to them. Let me drop by saying this.
Hazardous.
There is a particular, I won't mention the name of the hospital. They closed down their psychiatry unit. They closed down a whole unit because there were no doctors to attend to them. And I've heard of several other hospitals. And for me, you know, I think the government have started doing it, and it's a vantage position for those that have ideas and understanding of the healthcare system. Private-public partnership of the healthcare system is going to solve most of this problem. If I put my money in a general hospital, I will ensure that I face it and ensure that it prospers, because my money is involved. But the moment is nobody's money, because government money is like nobody's money. So people just treat it the way they want it. They resume when they want. Funny enough, somebody was going to resign from my hospital, and I called and I asked her, I said, is it the pay? I can even increase your pay. Do you know what she said? She said, job security. I said, who? Job security. I said, why did you say that? I said, because here, you are always very strict with the way we handle patients and all of that, and everybody's always on their toes. I said, so you want to go to a place where you will not be on your toes? I said, so I can see. She wants to go to a place where she can come anytime she wants, anytime she feels like leaving. Nobody's checking. Nobody's on her toe, like keeping her on her toes. That's where she wants to go and walk. And I told her, goodbye. I mean, I don't even want a staff like you, because that is it. People are rushing to get government job. And if you ask them, their first reason is job security. So why is job security a thing? Because in the private sector, they won't allow you to do some things.
There are more eyes on you.
Yes, because my money is involved. My investment is involved. And that is one of the reasons why the healthcare system is where it is right now. You know, people feel like if I work with the government, they can't just come and sack me. And I asked her a question. I said, and I mentioned 2 other staff. I said, do you think I can let this person go? She said, no. I said, so why do you think I will not let her go? She said, because, she does a lot. I said, that is it.
Why can't you do a lot?
Why can't you just do a lot? So that's it.
Wow. Amazing. Now let's talk about patients and, you know, how they consider, you know, how they treat their health. So what are the common misconceptions patients have about their health or even treatments? And how do you ensure, you know, an effective communication discussing these different points with them?
To be honest, after COVID, there was an improvement
I can imagine.
in the health consciousness of people. We can also rule out this socioeconomic factor, because you're coming to the hospital and you know you're going to spend X amount of money. Would you not rather, sometimes people prefer to go to the pharmacy, they prefer to go to the traditional concussion, you know. But like I said, the consciousness of healthcare increased a bit after COVID. People came to the understanding that no matter how rich you are, when it comes to healthcare, if your health is not good, you're as poor as any other person, because you can just leave that healthcare and just, you know, cross to the other side in that sense. So I feel strongly that it's getting better, and it's now in the hands of all healthcare workers to keep advocating for people's awareness. Actually, we should keep up with the awareness. It can never be enough. The government supporting such awareness, policies being made around such awareness. I mean, a lot of awareness on healthcare is ongoing right now, but still, I still don't feel like we've done as much as we should do, because people don't come to the hospital until it becomes worse.
Even when they see the symptoms.
Even when they see the symptoms. So their first line of contact is not the hospital.
It's the pharmacy.
It's the pharmacy. They go to the pharmacy, they diagnose themselves, and when they see that after 3 days or 4 days they are not getting better, then some of them will call their family members that are doctors or in the healthcare space. They will still want to try again. Maybe the 3rd contact will eventually now be the hospital. Most of the time, they bring them in. They don't walk in by themselves. So they are being rushed in.
Damage has been done.
Damage has been done. And we see that happen again and again. And to be honest, I mentioned socioeconomic factor, but that's not number one. The first on the list is mindset. Because I've seen very wealthy people go down, die, cheap death, just because the mindset of, if I use this concussion, I'm going to be okay. Negligence. I heard of a billionaire's son that passed on during this outbreak of cholera. He started purging and he kept purging. Then they called a particular person to come and see him at home. Maybe a nurse, I can't remember. The just said they called someone. And when the person saw, the person said, no, we'll just rehydrate. So they kept rehydrating. But the approach to treating cholera is not like that. And at the end of the day, I think the guy from hypovolemic shock, he died. So it's nothing about money now. It's their mindset towards healthcare. So I think that needs to change. And the way I manage it is that whenever I see or I come across anybody, I want to tell them about the complications that can...
repercussions.
The consequences of not taking their healthcare. And trust me, the wellness clinic in Nigeria right now is not a thing. It's part of the advocacy, things that I'm advocating for at the moment. Wellness clinic. Can people that are well, the only set of well people that go to the hospital are those that want to do plastic surgeries. But I'm not saying some people don't go for wellness clinic. I'm only saying that it's not a thing yet. Where, when you buy a brand new car, whether the car is faulty or not, after 3 months, you take it to the mechanic's workshop for servicing and you re-oil and all of that. People don't do that to their healthcare, to their health rather. They will rather wait until there is a symptom.
They don't even do that to their cars. They wait until the car goes
if you buy Tokumbo car, you will do that. But if you buy a brand new car, maybe like you spent maybe like a 200 million on a car, no, you go for checkup.
I just feel people are naturally careless about things in general, most especially their health.
It's still the upbringing, foundational cracks and all of that.
Amazing. We've had an interesting session so far, and I'm sure the audience watching can also agree. So while we come towards the end of this first part, I want, Mr. Nifemi to advise those people who are looking to start a career in the healthcare sector. What advice would you give to them?
Think twice.
Think twice. Straight to the point.
Think twice. And come in with the mindset, with a solution provider mindset. Because one of the things that would help technology advancement in healthcare is the curriculum and the set of teachers. But if you have a new breed of people coming into this space, all right, and they're coming in with the mindset of preferring solutions. So when they are teaching you in class, you're asking yourself, you allow that knowledge to go through your mind, asking questions. How do we make this thing easier? How does technology come into this? So some of us right now, because we've gone through that system, it's a bit difficult for us to unlearn some of those things. But for the people just coming in, why not? The healthcare space is still a green ocean. There are a lot of things that are yet to be achieved. So they shouldn't run away from it. And, people are talking about tech right now. There was a time that tech was just tech. But it came to a point where tech started creating value in other people's space. So it's the same thing. If you're coming into the healthcare space, think about the problems and take it back to the tech. Take it back to the tech guys. And you'll see that before you know it, you will not just be satisfied financially. You'll be satisfied, value-wise, because you've created a value. There's something I'm working on. It's going to drop very soon. I've converted every healthcare services to products. Such that you can click. It's just like an healthcare Amazon. You can go online, you can click malaria treatment. All of the treatment will come to your house. You can click, from the space of your house, you can just click treatment for infection. Cholera treatment. You go to the hospital because you have to go to an isolation center. So what I've done is that I've been able to look at the time people spend in the hospital. Might be the reason why some people don't come to the hospital. And there are 5 steps or 5 things you do in the outpatient department. The first thing is that you come into the hospital, you register, After registration, you go for your vital signs. After vital signs, you see a doctor. After seeing the doctor, he wants to buttress his diagnosis. He sends you to the lab or the diagnostic center. After all of that, he reviews your results and you go to the pharmacy and you go home. These 5 steps can actually be done within the 4 walls of your house. So you can see me trying to bring technology into solving the problems of healthcare. Yes. So people come to the hospital. Imagine you are a very busy person and I can count times that you've gone to the hospital and the time that you don't actually have, you spend it waiting on the line.
Correct.
Then even the healthcare you get there is not holistic. There are like 5 or 15 patients waiting to be seen. So the doctor wants to rush up with you so that he can also attend to the next person. But imagine them coming to your house, the 4 walls, your own comfort zone, and they are delivering all of these things to you. You know, so we've converted all the services to products. You can click in and buy a product, then it will be delivered to you. That is bringing technology into healthcare and solving a major problem in the healthcare space. So anybody coming into the profession right now should not come in the way some of us came in, that I want to go and serve humanity. Because at the end of the day, after serving humanity and you are not getting a commensurated value, like money-wise,
maintain it.
You won't be able to maintain that passion. With time, you just see that the passion will die. So come in. I mean, it's a good space. I'm encouraging all the young ones. It's a good space. Nurses, doctors, pharmacists, lab scientists, all of that. And I think I need to go back a bit. There is this policy that has just been made by the federal government to not just cushion the effect of medical personnel leaving the country. They're also looking into how to bring them back. So I hopefully, and I'm optimistic about it. I've not gone through the details of what the plans are, but maybe when I go through it, I can tell whether this thing is going to work or it's not going to work. But I'm happy that the government is looking into it and it's something is applaudable. And hopefully the politics and all of the other factors will not hijack these brilliant ideas that people are putting on the table.
Thank you so much, Mr. Nifemi. Now, I'm sure the audience have learned a whole lot from your session. I'm sure you all have questions. If you have questions, make sure you drop them in the comment section, and I will personally ensure that Mr. Nifemi answers every single one of them. Now we have come to the end of this first part of our conversation on the healthcare, and I'm super excited to bring on board someone who I consider a legal luminary.